Good afternoon or good evening. Vaccines are one of the most effective public health tools that we have in our country and in our history. And over the past 50 years, vaccines have saved more than 150 million lives globally. That's according to the World Health Organization. In addition, there has been and continues a significant amount of misinformation, disinformation, and hesitancy about the continuation of the threat from vaccines, their usage, and the confidence in them. But we know vaccines save lives. The Cobb Institute and the National Medical Association have been instrumental in addressing vaccine hesitancy and advancing immunization campaigns for a number of years, especially to vulnerable populations. Tonight, our educational initiative and similar programs will hopefully serve as a model for improving vaccination rates and combating some of the misinformation that continues to swirl, whether we're getting that information in our news outlets or unscientific information. So, the National Medical Association and the Cobb Health Institute is really dedicated to combating this misinformation by providing educational resources to healthcare providers, our members, as well as the communities in which we serve. This educational initiative aims to increase your awareness about immunizations and reduce the hesitance that's surrounding some of the vaccines, especially for influenza, COVID, RSV, and perhaps other viral infections. It is important, in my estimation, as well as the Cobb Institute, for us to arm our public with knowledge, to stress joining together with other like-minded organizations and groups in order to promote a shared information and decision-making tools to develop healthier communities. So tonight we're going to address the role of timely vaccinations in our vulnerable communities by providing you with accurate information about, as I've indicated, the influenza, COVID, RSV. Perhaps we'll even throw in something about pneumonia, as there's some new information coming out. We have an esteemed panel of 3 highly qualified physicians that will cover areas such as emergency medicine, infectious diseases, pediatrics, OBGYN, because we know that pregnant women and infants are really at the forefront of complications. So let me introduce our speakers. Dr. Rose Gonzalez is our emergency room physician. She, as I've indicated, specializes in emergency medicine at the Westspan York Hospital. Her education was completed at Drexel University. She has more than 13 years of experience as an emergency physician. She is currently the assistant professor at the Florida State University College of Medicine, as well as serving as a faculty member at the Sarasota Memorial Hospital. Dr. Gonzalez will add additional information during her presentation. With us also is Dr. Audra Meadows. She is a board-certified obstetrician gynecologist with nearly 20 years of experience providing compassionate care to women and birthing individuals. She is an associate professor at the University of California, San Diego School of Medicine. Her research that has previously been funded by the National Institutes of Health and the Robert Wood Johnson Foundation has a focus on improving pregnancy care and outcomes by centering the voice of pregnant and parenting individuals. She is dedicated to optimizing wellness before, during, and after pregnancy. She has been a former assistant professor at the Harvard School of Medicine, and she earned her degree at the University of Texas, San Antonio, and the Brigham and Women's Hospital in Massachusetts. She also has a public health degree. When I introduce the other speaker, I will show you the common thread that we all have in common. The third presenter is Dr. Tanya Rogo. She is an associate professor in pediatrics at the Warren Alpert Medical School of Brown University. She also directs the Pediatric Infectious Disease Fellowship. She earned her medical degree and her public health degree in tropical medicine from Tulane University, as well as completing her pediatric residency. She has a global health, she does global health work that includes developing a pediatric residency program at the University of Rwanda and ongoing collaboration also in Kenya, between Kenya and Rwanda. Now, let me just tell you that these three ladies, of course, we're all members of the National Medical Association. I am very interested in international health and provide a lot of international responsibility in the area of oncology, my specialty, and that is in common with Dr. Rogo. I am also a retired colonel in the U.S. Army, and I think, Dr. Gonzalez, you were in the military. And of course, one of the first interests that I had was in OB, and of course, in talking about health care for pregnant women, particularly with complications from clotting and all of that, it sort of leads into the hematology area of my training. And I have that in common with Dr. Meadows. And we are all tremendously interested in health equity, in making a healthier community for our population. And if we don't do it now, as you heard from the first thing that I said about vaccines being the most effective public health tool, according to the World Health Organization, well, I know that you've seen the news that our current administration has removed us from the World Health Organization. So let us start by our first presentation, Dr. Gonzalez. Since I see you at the top of the screen, please provide some comments.
Yes, hi. I'm Rose Gonsalves, currently work as in emergency medicine. As an emergency medicine physician, I'm at the forefront fighting all illnesses. That include when we had a really, really extensive COVID pandemic, any kind of influenza, pneumonia, stroke, cardiac disease. I am there taking care of the patients. We are the first faces that they see when they enter the hospital. And doing this, I realized emergency medicine works closely with public health because there are so many diseases that could be prevented and so many ways that if our vulnerable population had more access to care, more information, that could prevent them from coming to the emergency department when they are the worst or when it's a little too late. So I have a big interest in public health. I actually studied a public health degree, but did not finish it. And that's why I think I am at the forefront with the NMA and also our local organization, the Gulf Coast Medical Society, educating our public, encouraging them, and fighting the misinformation. More than ever, I think we need to unify and provide education that's like free of biases so people can make up their mind, because it's there, and I can see it every day. People are coming with severe flu, where they end up having to be put in the ICU because their oxygen is low. We have babies coming because they have RSV, and they have to be hospitalized. We have so many things happening that could be prevented. I think vaccination, like we're gonna say over and over again, it's safe. Um, Comparing, I guess, the best public health advancement that was made in the history of mankind beside clean water is vaccination. And vaccination, I guess we can say they are the victim of their own success, because people are hesitant about getting vaccination because so many diseases were eradicated because of vaccination. So we are here, we're going to fight the information, and we're going to provide the information. And we hope everybody will trust us. And we hope people will understand that we have their best interests at heart. And that's why we are campaigning, we are encouraging the public to get vaccinated and prevent what could be prevented. Thank you.
Thank you. And now we'll hear from Dr. Meadows.
Hello, everyone. Happy to be here.
Good evening.
So when we're thinking about vaccines, there's a couple of things to think about the importance. And, I completely agree that vaccines are vital. They're a vital part of keeping populations healthy, in particular within pregnancy and OBGYN. They are vital for protecting women at every stage of life, and those who are reproductive individuals. They're also vital for protecting not just the mother but the baby, offering immunity before they're born. When it comes to thinking about obstetrics and gynecologic outcomes, unfortunately, maternal health outcomes in the United States have been worsening, and rates of severe maternal morbidity and maternal death have been rising and are more significant among some ethnic and racial groups, particularly those who identify as Black, Native American. And so in some areas, it depends on where you live. There'd be higher rates because there can be, we call maternity care deserts, and included in that lack of care that one may get, or one may not be getting, right? The lack of care is the lack of having access to vaccines. Why it's important to think about maternal morbidity and mortality in this is because those rates had already been getting worse in the United States, worsened even more during the COVID-19 pandemic at the height of it. And so that highlights the vulnerabilities that you have as a pregnant population. And so because pregnant patients, or pregnant individuals, I should say, face such higher risks of illness and death when they are infected with the COVID-19 virus, it was really important for us to get the message out for vaccination for COVID-19. Vaccination, as was already said, is the most effective tool we have to protect mothers and babies from preventable complications and to improve maternal health outcomes. So some of the vaccines that are important to talk about, I won't go into all of them just yet, and I'm sure more to say about it soon. But for a woman, we're thinking HPV vaccinations. That both male and female are open for that vaccination. MMR, measles, mumps, rubella vaccine, varicella or chickenpox vaccine, and hepatitis B. But then there are also very specific vaccinations we talk about during pregnancy. And those are the Tdap vaccine, that's tetanus, diphtheria, and pertussis, the influenza or flu vaccine, COVID-19, as we just discussed, and then RSV, or the respiratory syncytial virus vaccine. So it's important to understand how effective those vaccines not only are for protecting or providing immunization for the baby, but also down the road, helping to protect communities and your entire family. So in pregnancy, the pregnant person's immune system is naturally weakened, and that makes pregnant patients or pregnant people more susceptible to infections. It's why we also ask folks when they're pregnant to avoid eating raw foods, or to avoid eating deli meats, for instance, because your susceptibility to food-borne illness is so much higher. that also goes along with these respiratory viruses that we're talking about too, and those vaccinations that I just named. Why vaccines matter in pregnancy? They protect you, they protect your baby, and they also help prevent complications. The important thing also to say, and I love the comment that vaccinations are sort of the victim of their own success, is because they're safe. Vaccines are recommended during pregnancy because they're studied and they're monitored for safety. And organizations like the CDC and American College of OBGYN, American Academy of Family Practitioners, and more professional organizations, and also our World Health Organization, confirm the safety and effectiveness of vaccines.
Thank you. Okay, Dr. Rogo.
Thank you. And good evening, everyone. And I think it's perfect order that I come after emergency medicine and OBGYN because I take care of the babies after Dr. Meadows has delivered them. And to just emphasize what she said about vaccination and pregnancy, and also that women, before they get pregnant, being fully vaccinated, because there's some vaccines we can't give during pregnancy. And the importance of the mother being vaccinated is that her antibodies are then transferred to her baby, so that for the first 6 months of the baby's life, it's the mom's antibodies that are protecting them before the baby can form their own antibodies, which is why we emphasize so much for women or birthing individuals to be fully vaccinated. And in terms of pediatrics now, focusing on children, the leading causes of death in children under the age of 5 are pneumonia and diarrheal illness. And we have developed over the last century vaccines against those things. So first, in terms of diarrheal illness, we have the rotavirus vaccine, which used to be the leading cause of hospitalization from diarrheal illness. And I remember when I started residency in 2007, my first winter as an intern, back-to-back admissions of babies coming in, young children coming in with dehydration from diarrhea. And it's been more than a decade since I've admitted a child with rotavirus. We do see other diarrheal illnesses from other viruses that we don't have vaccines against, but we no longer see hospitalizations from rotavirus because of the success of vaccination. And then in terms of pneumonia, the leading cause of viral pneumonia in children is RSV, which you've heard about before, syncytial virus. And it's also the leading cause of infant hospitalization. And fortunately, in the past year, the FDA has approved a new RSV vaccine, which can now be given to pregnant individuals so that their antibodies then transfer to the baby. But if the pregnant individual doesn't have a chance to get vaccinated, there's now also a monoclonal antibody that is available for all infants under the age of 8 months during the RSV season. And generally, depending on your state, the RSV season, it goes from October to March. And so ideally, the baby gets that in the first 10 days of life if they're born within the RSV season. And so I'm looking forward to seeing the RSV hospitalization numbers from this season, because this is the first full season that we've had all of these available. And I expect to see that we'll have seen the hospitalization rates go down from RSV, because we had, if you recall, 2 winters ago, we had a really, really bad RSV season. In addition, in terms of pneumonia in children, we also have COVID-19 and we have influenza. And I think one of the challenges that we have with those two vaccines is that people say, I got vaccinated, but I still got sick. And I want to emphasize that the point of vaccination is that it primes your immune system so that you have the antibody, so that when you see that infection, you're able to fight it off so that you don't get hospitalized and you don't die from it. And for people who get vaccinated against COVID and influenza, it's protective against hospitalization and death. And so that's why we emphasize still, yes, we're not saying that if you get the COVID vaccine, you're not going to get COVID. But what we are saying is that it's protective against hospitalization and death. And the younger you are, the more likely you are to be severely ill from those viruses. And both COVID and the flu vaccine are available for infants starting at 6 months of age. And then we also have the pneumococcal vaccine, which has been updated in the last couple of years. So there are multiple strains of the pneumococcal bacteria. And what they've done with the vaccine is that they've updated the number of strains that are covered in the vaccine, so that we cover more of them that cause pneumonia and things like otitis media or ear infections and other upper respiratory illnesses. And then we also have Haemophilus influenza, another vaccine that's given to babies. So both the pneumococcal and the Haemophilus influenza vaccine are given at 2, 4, and 6 months of age. And so we definitely encourage our parents to vaccinate their children so that they can go out there and fight these infections that are circulating. Thank you.
Thank you so much. And I failed to say that for our listening audience, if you have questions, please put them in the chat box and we will be able to address those questions for you. But I want to start off with a couple of questions that I have, and we'll go around. My first question that from a pregnant woman who has a great deal of fear about getting any kind of vaccines. I mean, she's heard stories about it's not safe while you're pregnant, or it's not safe in this particular trimester. And so she's concerned because now we had, as in the last fall, we talked about the RSV and how it was impacting children. And you just heard from Dr. Rogo. And sometimes we think that COVID has gone away, but we're still seeing COVID coming in and people being hospitalized. So what would you tell this young woman who is pregnant and whether she should get the vaccine, whether is it safe to get both the COVID and the influenza? What are the other kinds of things would you address for this young lady?
Yeah, and in short, I recommend vaccination in pregnancy. It's very important for safety. They're safe, but it's also important for the safety of the pregnancy for the pregnant individual. So let me say this. What's important to know is that in our world is ever changing, right? Our technologies change and develop. What platform people are using, TikTok or X, these names and what we're doing with social media change and develop. Our political landscapes change and develop. Similarly, what we're exposed to in our environment changes, and we have developments around that as well. COVID as a virus has been in our communities. And then when the COVID-19 virus started to go across the globe and really causing illness and death in such large numbers, then we were able to respond to that. That is just a huge, wonderful benefit of what we've been able to do with medical advancements. What's really saddening is that it led to so much increase in distrust. And so let's kind of speak to the root of that a little bit. So some of the root of that is when any particular health condition happens or increases or gets worse. We think in this country, we can think about hypertension and diabetes and these other chronic conditions. When you have communities that have been more marginalized or are more vulnerable, more often we see a worsening of those health outcomes in those communities. And so, particularly related to COVID, I think many of us, particularly those, who were taking a public health lens, were really quite struck when we saw COVID-19 hit our shores. We think about Ebola and other viruses where we would see and watch what was happening in other countries. It wasn't really coming here to the United States. Zika was something we'd watched before that was really important in the pregnant population. So as I'm saying that, you can hear me talking about over the years, we've heard of different viruses that we've wondered while we've been pregnant, while individuals or people have been pregnant, is this going to affect me? When COVID came and it was originating from a place many people who were Black and brown in the United States hadn't been, but then the Black and brown population was more affected by it, it was really mind-boggling to a lot of folks. And I think those of us who've watched the data and understand how disparities sort of play out, none of us were really surprised. But that being said, we got to work fast on what to do to try and help protect communities, particularly the most vulnerable communities and communities that were on higher numbers. So the public health departments were seeing what was happening with COVID. I remember when we had H1N1 first hit and really caused a big problem in the pregnant population, et cetera. So over the years, different viruses have really led to some tremendous increases in getting sick during pregnancy. And what we've seen is the level of trust sort of really plays a role in whether or not people are able to bring themselves to access. Level of communication from our healthcare systems and our public health systems affect that. So, the reason why I'm saying all of this around one very simple question, should I get a vaccine? And the answer is yes, is that it is no wonder any one person would even ask this question, because there's so many things at play in our psyche that we may not be putting name or words to. But when you start putting words to the fact that there's so much going on, there are these medical advances you'd never heard of until COVID hits. And then now we've got this new kind of vaccine available. There are these viruses that are coming out that you've never heard of, that researchers might have heard of before, but it wasn't making it to the mainstream or social media. These kinds of things. It becomes really difficult to make health decisions for yourself, especially in this age of misinformation and disinformation. You can go online and find two different sides to the same argument very easily. With all that being said, it's important to know that the first thing that I would suggest anyone do in these situations is always have connections to what I call your doctor right, or your nurse right, or your midwife right? The right person for you that knows you, connects to you, communicates well with you in the language that you speak, is aware of who you are culturally, and is somebody that you can trust. When you have that trust, it becomes easier to have the conversations that are important to understand which vaccines you need, which vaccines you should get, in what order you're planning on getting them. And so I'll give an example to answer this person's question even further. If you were in clinic with me and we've known each other since you were, in early 20s, you've had your pap smear, we've had well women exams, we've had lots of conversations, and it's a privilege for me, lucky enough for me, that I then get to know you during the time that you become pregnant, and now you're getting ready to expand your family. That's the most important part, is that this is a normal, natural human process that you're going through, and we want to make the best of it and the most of it for you. We want to optimize this experience. The first thing is to offer this quality care is keep you at the center, make sure it's patient-centered. And like you said, Dr. Brown, make sure that what we're doing is timely and effective and evidence-based and efficient, right? And that's important. And then leading to equity. And in doing all that, we want to make sure that you understand as a person, as a pregnant person, what it is I'm offering. So I often will tell folks, especially, let's just take the month of October. It's respiratory virus season by the time you hit October, right? So we've got 4 vaccinations in pregnancy that we're often going to start offering to people. They come at different times in gestational age, because what we're trying to do is maximize the time when the antibodies will then cross through the placenta to support the baby developing some immunity and some support. And so, for instance, the one I mentioned first, Tdap, or tetanus diphtheria pertussis, really what we're looking for is the pertussis portion of that, to protect against what's called whooping cough. And so when we're offering that, we offer between 27 and 36 weeks. So if you're between 27 and 36 weeks, anytime, any of the year during pregnancy, we're offering that. So that's a perennial vaccination. Influenza is the second one, though. So again, I'm saying we're in October because now you're hearing all of them. So I also say you're also going to be offered the flu, but you're offered the flu shot at any time during pregnancy. And some people will say, I don't want to get this in the first trimester while the baby's developing. And I'll say it is safe in all trimesters. And if we're going to make a delay, we're going to work together and we're going to partner and have a shared decision here. We're going to talk about how to keep yourself safe and how to protect yourself from respiratory viruses until you've been vaccinated and start to develop some immunity. I'm then going to talk about the COVID-19 vaccine. And I'm going to say, if you have not had your original series, or you haven't had your boosters, we'll talk about the safety of getting vaccinated in pregnancy. And then if you're between, and for the state of California, if you're between the months of September and January, we're definitely going to be offering you the RSV vaccine as well. But that's only offered between 32 and 36 weeks gestation. So you're going to be hearing these conversations at different times. Hopefully you're in a practice where you may get some information very early on about the entire trajectory of your pregnancy and what all we're offering. Doesn't always happen. And the good thing when you're with a clinician that you really enjoy working with and you feel connected to, and respect and trust, it's easier to have those conversations, to ask your questions, to feel like you're getting the answers in ways that you understand, and feel that you're making a shared decision with your provider. So I will say again, my short answer to should I get vaccinated is always yes. And I'll lean in to talk about the safety. But the very long answer is everybody's lives are very unique to themselves. And the circumstances that surround you that make you either trustful or mistrustful can be very different. So make sure you're having those conversations with your clinician, your provider, and ensure that you feel confident in the decisions you're making to have the information you need and to be allowed to have the conversation even more than once if you need to till you feel confident moving forward.
Thank you. Excellent answer. And I hope that this rings home for all of the pregnant women that are out there that may have some hesitancy on getting the vaccine. The question that's similar to that, Dr. Rogo, is I'd like to get the flu vaccine, but it's almost February now. Is it too late to get the vaccine? And this question is also about this person has heard that people who get the vaccine can sometimes come down with a bad case of the flu. Is that true? And is it too late?
Thank you. So to answer the first question about whether or not it's too late to get the flu vaccine, it is not. It is January. We're still in flu season. And depending on where you are, typically the flu vaccine is available until April or May even. And so if just ask your primary care physician, go to your pharmacy and ask, because depending on where you are, pharmacies give the vaccine as well. But definitely in January, it's not too late to get the flu vaccine. In addition, a question that people ask sometimes is, why do I need to get the flu vaccine every year? And so the reason is that there are multiple strains of the flu. And what they do every year is that they try and forecast which strains are going to be circulating, and they update the vaccine. And so that's why it's an annual vaccine. And then the second question I think you said was about so that people have heard that people get sick after getting the flu, right?
Yes.
So yeah. And so, well, one, I think some of it is myth because when a lot of the time when people tell you they have the flu, it's not actual influenza, but another respiratory virus, right? And the symptoms can be similar in terms of the respiratory viruses. But getting the influenza vaccine is not going to cause you to get an influenza infection that's worse. What it does is that you have the antibodies on board so that it should prevent you from getting severely ill and getting hospitalized. And which is why we emphasize vaccination, particularly for people who are at risk for getting really sick with pneumonia from the flu or getting complications. So if you have asthma, for example, if you have heart disease, if you're diabetic, if you're immune compromised, there are several categories. If you're sickle cell, there's several categories of people who are at higher risk for being sicker if they have the misfortune of being infected with influenza. And so definitely encourage you to speak to your physician. I think Dr. Meadows spoke really well about having hopefully healthcare providers that you have a trusting relationship with, that you can talk about what your individual situation is and whether or not you in particular are at an increased risk, and and would be definitely important for you to get vaccinated. But universal vaccination, though, for everyone, we encourage that because it also we have herd immunity, right? So if we don't want just one person to get vaccinated, but everyone around. And coming back to pediatrics, as a pediatrician, when the baby is first born and they can't get vaccinated yet, we want a protective cocoon around the baby. And so the adults and older children who are going to be at home or are going back and forth to work and school, ideally, if they can be fully vaccinated so that they don't get sick and bring something home to the baby, right? So it's not just the baby getting vaccinated and the mother who gave birth to get vaccinated, but also everyone around so that we have a protective circle around the baby.
Okay, thank you. So now, Dr. Gonzalez, here is a person that has symptoms such as a runny nose, a little fever, coughing, sneezing, and at home they took the COVID test. it's positive. Should they come to the emergency department or should they go to an urgent care? What should they do?
Well, I think it depends on your risk factors and how you're feeling. If you are an individual that's immunocompromised, meaning you have like any history of like asthma, you have any kind of chronic bronchitis or respiratory underlying respiratory illnesses, if you have like hypertension, diabetes, or if you're over the age of 60 and you're feeling bad, not just like you're having like just some congestion and sneezing, but you feel like you can't breathe, you're having chest pain, by all means, you need to come to the emergency department because we are more equipped to get a chest x-ray and do lab to make sure there's no other complication than just the COVID, especially if you haven't got your COVID immunization vaccine. I'll say urgent care, it's good to go to urgent care if it's very benign. But what I found, like especially for individuals that are at high risk and older or younger kids, like any child under the age of 6 months, usually when they go to urgent care, especially if they have any signs of being severely ill, where their oxygen might be low, their respiratory rate is high, they're going to immediately transfer them to the emergency department because we are more equipped to take care of these people. One thing that I will add is despite the great success of vaccination, we have some hesitancy. And we know that certain populations, especially our population, where people are more likely to have, some chronic illnesses such as diabetes, hypertension, and due to lack of access, where they're not being well managed. So because of that, they're gonna be getting sicker from getting any kind of illnesses. If they get like pneumonia, they are the one coming to the ER where the oxygen is like 88% and they need to be admitted. Also, because of that, their glucose is going to be in the 500 and they're going to have other complications. So it's important to really take care of yourself and see your primary care doctor, have that conversation with them, see what can I do to prevent that, but also take care of yourself on a regular basis. Take your blood pressure medication, take your diabetic medication, go on that diet so you can lose weight, because all those factors make you more immunocompromised. And when you have those chronic illnesses, any kind of like illness you have will also be worse. One other thing that I will mention, Dr. Rogo and Dr. Meadows speak about like being vaccinated during pregnancy and also vaccinating the younger child. Because, for example, the H influenza vaccine, it's been safe. People have been taking it for years. I've taken it. We're giving it to our children. Particularly where I work in Florida, I'm not going to have any name, and it has nothing to do with politics. We have a small subset of ethnic group who choose not to get vaccinated. And it's not because of politics. It's cultural. They've, even way before COVID and the vaccine hesitancy, they choose not to get vaccinated. And that's because of their culture. So there are diseases that I learned in books. We talk about them in residency. We talk about them during our training that I've never seen until I came to practice in this area. Like about 2 months ago, I had a child that had epiglottitis because they did not get their H influenza vaccine. And it was a very scary moment because if you have epiglottitis, your airway swelled up. The kid did not get oxygen and they could die. So the scariest thing is they came to my freestanding ER. Here I am, just me, my nurse, and respiratory therapist. I do not have anesthesia. So I had to quickly stabilize that child and by helicopter transfer them to the children's hospitals. So even those diseases that we think are no longer in our population, but they're still there, and we're still getting people getting very sick. I had an older gentleman with measles, and the measles got into his lungs, and he ended up having really bad pneumonia and had to be intubated, put on a ventilator and go into the ICU. So when people do not get protected, when they don't get vaccinated, those vaccination, they do get sick, and the consequences are worse than the regular population who get vaccinated. So we are still seeing, kids with bad epiglottitis. We are still seeing kids getting like measles encephalitis, and all these are very preventable. And they can, when somebody gets, especially a kid, we had that also not too long ago, a young kid that ended up with like measles encephalitis. There was consequences where they can have learning difficulties because their brain is swelled up. They have to put a tube down to breathe for them, and all these conditions are extremely preventable. So vaccines are not 100%, but if there's something we can do to help prevent a condition, is best to get it.
And since I'm speaking with you, Dr. Gonzalez, does the emergency room give vaccines? Do you vaccinate or do you send them to their primary care provider?
So we do not give vaccination in the emergency department. So some of the urgent care do, and they can also get them from their primary care doctor. They can get them from the health department, and they can get them from actually any kind of pharmacy. I don't want. I'm not endorsing any particular pharmacies, but like CVS, Walmart, Walgreens, any of your neighborhood pharmacies. I talk about this because these are the ones I have in my neighborhood. They also have vaccinations, and they can provide that. So we do not typically vaccinate patients in the emergency department.
Okay. Dr. Rogo, here's a person that had COVID several times since the pandemic. They also had their COVID shot and boosters. And they're concerned as to why do they need to continue to get the COVID vaccine and the flu shot, and whether they should get them together.
Okay. So what we've seen happen with COVID-19 is that the original virus has mutated and there are new strains that keep coming up because it continues to circulate in the population. And what we've seen is with the changes in the strains, that the antibodies that someone has from an earlier strain is not necessarily protective against the new strain. And so what they've done the last 3 years, essentially, is each year they've updated the COVID vaccine with the new strains. And so the reason I would recommend that you continue to get your COVID vaccine booster is that so far, like right now, we're on the 2024 version, is that it's updated against what's currently circulating right now.
Mm-hmm.
So if you've never gotten the COVID-19 vaccine, you can go and just get the 2024 vaccine and you're up to date. If you received the original series or previous boosters, but you haven't received the 2024 version of the vaccine, I recommend that you go get that so that you have immunity against what's currently circulating. And so that's similar also with influenza, because influenza has multiple strains circulating and they update the vaccine every year to try and match what's circulating for that year. And that's the reason why the influenza vaccine is annual. And I wouldn't say that the COVID-19 vaccine is annual. That's still, the verdict is still out on that. But essentially, if your doctor tells you that there's a new vaccine out for COVID and recommends you to get it, that's the reason why, is that it's an updated vaccine.
Mm-hmm. And can I add that we are still having people come into the hospital with like their oxygen being very low, with their lungs, very bad infection going down to their lungs, needed to be put on a ventilator from COVID and influenza. I mean, it's not what it was like 4 years ago, but people are still getting sick from COVID, getting very sick, and some people are still dying from COVID, and they can also still die from the flu. So it's not because it's not a pandemic the way people were talking about it, because we had a high mortality, that it's not happening still. It's still happening. We're still having some patient, unfortunately, getting extremely sick, going to the ICU, and a few of them not making it from those infections.
Yes.
And if I thank you for that, if I can add on to that, actually, we do not see hospitalization from COVID in pediatrics in vaccinated children. Right. So all of our hospitalizations for children with COVID are children who are not vaccinated. And in addition, in children, we have something called MIS-C, the multisystem inflammatory syndrome in children, which is an inflammatory condition that can occur a month or so after a child has had the COVID-19 vaccine, and they can get very sick. And children who are vaccinated do not get MIS-C, right? So if you vaccinate your child against COVID, you're protecting them against hospitalization, but you're also protecting them against long COVID and MIS-C.
Yes.
Can I also add one last comment to
Yes,
this?
please.
I really appreciate the way the question was phrased too, of, why do I need to get the vaccine every year? And, you've heard medical and clinical reasons why that's important. But one thing to also keep in mind is you as a person, you're important, right? And so if you're important and you're going to care for your own health, it's important to stop and think about, how can I protect myself from being ill or sick? How can I care for myself? And that should be something you do frequently, which is why it's great to get your annual exams and have these conversations, because at various different stages in life, there are times when we aren't caring for ourselves as well. We're worried about family or others, and in our circles, and we may be turning our attention away from ourselves. And I'm saying that because as an OBGYN, I see a lot of folks who are perimenopausal, postmenopausal, or menopausal, et cetera. And they're thinking about their families, they're thinking about other people, and they're not stopping to think about their own health. And when they'll come in, even at a well-woman exam, I'll offer a flu vaccine. And I'll say, let's just pause and think about what's going to make you healthiest and most whole and optimize best you can. And then we'll go into other things. So I think in addition to really important medical reasons why that is the schedule of vaccination, it's really important for anyone, as you're asking questions about why you should do something, is first just take that deep breath and pause and turn inward and say, I am important. And how healthy I am is important to who I am as an individual and how I live my life. And then we'll go, then go into your other questions with your provider.
And I should say, because women generally are the caregivers, we have to make sure that we've cared for ourselves so that we can be in great shape to care for the others. And so we should not forget about that. So that's also important. Another question for you, Dr. Meadows. This pregnant woman who she's postpartum. Her baby died last year at the end of her pregnancy, and she had had the vaccine. So, of course, there's a great deal of fear that perhaps that vaccine caused her child to expire. Can you talk a little bit about adverse effects that not necessarily related to the death of her unborn fetus, but it's a question that comes up in our community?
Yeah, the adverse effects that we mostly talk about, for the virus, for the vaccines that we recommend while someone is pregnant, really are just the sort of pain and soreness at the insertion site. And then sometimes people may have a little bit of feeling of stuffiness, feeling maybe even a little run down. Very rarely does that happen. But that's typically what it is. We used to also decipher, and this is not so much the case anymore. We used to also decipher if you have an allergy, like an egg allergy. So what the vaccine is within, should we avoid a particular preparation of that vaccine so that we don't cause an allergic response that someone may have. And that has been, I have to tell you, even in my 25 plus career, I haven't even seen someone have an allergy to a vaccination. So it's not a common experience. I'll let Dr. Rogel maybe speak to that more if I have that wrong. But just in my experience, I haven't seen that often. And the complications are not there for me to speak to anything that I'd be more concerned about. We won't offer something that we think is going to cause increased morbidity or illness for the mother, nor increased morbidity or death, particularly for the baby and the fetus. And so, to the person that asked that question, my heart goes out to you. It's just a tremendous tragedy to experience something like that, and I'm very sorry that happened. And to understand more about what that was due to and how that was caused, I hope you've had a conversation with your healthcare team. And even if it isn't someone in your healthcare team, because if there's somebody that you just don't trust and don't want to talk to in the group that took care of you, you have access to your records, and you can take those records to another provider and also get a consultation from what's called an MFM, or a maternal fetal medicine doctor, high risk obstetrician, to think through what happened, what could have been the reasons for this, and how to prevent this for you in the future. And the things that will keep you safe moving forward could also be vaccination, but that's a big conversation now to have with someone, because when you've got that association, it takes time to unpack that and to feel better and feel more confident about the decisions you're making. So take your time and get some trusted support as you move through this.
Yes. A general question for all of us. We have Paxlovid that if you've had COVID and you to take it at a certain time, is that a discussion that you often have with your patients that come in, or that you should have in all of the situations of when you come down with the symptoms, and how soon, how do you get that? Do you give them a prescription, as it called in? So there's situations related to that. And particularly, even though we haven't spoken about elderly patients, that is something that you want to cover, because they tend to come in with symptoms and they get the test and it's COVID. How do they handle that? How soon do they get Paxlovid? Do they want to get it? Is there complication and adverse effects from the Paxlovid? So it's just a number of questions, and how do we address those in our patient population?
Yeah, I can take these questions because I deal with that on a regular basis. So the Paxlovid is, it's effective if you take it within the first 48 hours of the symptoms. Sometimes this is something I address with my patient. If you've been having it for 4 or 5 days, it's really probably not going to do a big difference. Now, there's quite some side effect from the Paxlovid. And also there's a lot of medication, a complication. Like if you're on different medication and you take the Paxlovid, you can have that. So what I usually do is to share decision-making. I'll talk to the patient and then I look at to see what medication they are on. And we are very lucky at my shop, my institution. I have a pharmacist 24 hours. So I will run down the list of medication and make sure there's no contraindication with them going on the Paxlovid, because first is do no harm. So there's no point of me giving you a medication if it's gonna have a different effect because of one of your heart medication. One of the medication that there's a warning, it's a cholesterol medication, the statins. And we have a lot of elderly patients that have high cholesterol and they are on the statin medication. And that one, it's not bad because usually you just have to hold your statin for 3 or 4 days. So it's something that, and it's not going to cause you any harm to hold your statin for 3 or 4 days. But let's say somebody is on a cancer medication that they can afford to hold. Somebody is on a anticoagulant like Eliquis or something like that, then it has to be a shared decision making where you look at risk versus benefits. And this is what we do in the emergency department. I do not have a lot of time, but these are important information. These are important conversation that we have to share decision making. And then we offer them based on their symptoms, based on the onset of their illnesses, and also whether or not the side effect that they could have from the Paxlovid based on what medication they are on. So it's a shared decision making that we do with our patients for that. Okay. And we do offer it. And we don't offer it not only to elderly, but pregnant patient, also patient with cancer, anybody that's immunocompromised, the Paxlovid could be very helpful.
Yes. Other comments from?
Yeah, sorry. From the pediatric perspective. So Paxlovid is approved for age 12 and older. So if you have a child who's under the age of 12, who is high risk for complications for COVID, they can get something called remdesivir, which is an IV medication. Now, of course, the challenge is because it's IV, generally they need to be at an infusion center or they need to be hospitalized. And so I encourage any parents of a child who's at high risk, who gets COVID, to speak to your pediatrician, because they typically will then call an infectious disease doctor. And then I help the community pediatricians work out where they can send the child to get infusions of remdesivir.
Okay.
I was just going to add, it is true that it is safe to use in pregnancy, as already been said. This is where, for a lot of folks, it's the risk-benefit basis. And so in our breastfeeding individuals, it depends. and in our pregnant individuals depends. If you are at risk for progression to severe disease, we highly recommend it. If you've not been vaccinated and you're at risk for progression to severe disease, we recommend it. There are some folks who've been vaccinated, who are pregnant, who get COVID, their disease experience, or their experience of COVID, I should say, is pretty mild, and they don't even let us know until after the fact, so it does need to be used within the first 5 days. And so if you know you have chronic conditions or possible complications moving forward, please let someone know early, because timing is important. I think Dr. Brown started with that with vaccinations and even with Paxlovid, timing is really crucial. So make sure that your healthcare providers know and that we can offer you an effective treatment in a timely manner.
Thank you so much. Here's sort of a general question, because many times a person wishes to get the vaccine, but a family member says, no, you shouldn't get that vaccine. It doesn't work. You'll have complications. How do they navigate the family relative situation when they really want to get the vaccine? Particularly seeing things on the internet and TV saying this vaccine is not going to work, and even that the government's going to stop giving out vaccines. So how do we address this in our population?
Yeah, I think just let people know that you still can get very sick, and it's in everything like we talk about in medicine, risk versus benefit ratio. So the risk of, especially if you're an individual that has high blood pressure, diabetes, kidney disease, you're on dialysis, you have any kind of heart condition, cancer, you are more vulnerable. And like Dr. Meadows and Dr. Rogo mentioned earlier, each experience is an individualized experience. So you know what you're at risk for. You should, take the time to do your own research and talk to your primary care doctor and say if this is worth the risk, and we do everything. There's a side effect, everything in medicine. But you look at the amount of people that have gotten, vaccinated from COVID or the flu, and look at the people that did not and some of the complications that they have. So again, the vaccination is safe. And I think it's, have that conversation for yourself and see what are you willing to risk. But it's definitely safe, and you should get it.
Yes.
Yeah,
You don't want to break up a marriage, though. Yes, correct.
Exactly. I'll add to that, because man, that's a heavy burden to bear, isn't it? To think about caring for yourself and then wanting to make sure everyone around you is healthy. And I would say, some of the work that I do and some research that folks do and some public health work that's happening out there really tries to work to take that load off of one person's shoulders. Hopefully you're getting lots of messages. Hopefully you're seeing billboards. You might be getting mailers from your healthcare institution or your healthcare clinic. You should be seeing commercials. You should be hopefully having trusted messengers, people who are being educated in your community and having these conversations at local community spaces and places where you might frequent. So the goal is that we as physicians and public health practitioners are getting out there and getting the message out such that your voice is only layered with many, many, many other voices. If you feel like your voice is solo, things like what you're watching right now is really helpful. Maybe we have a recorded version available you could show. Finding YouTube videos that give some of that information can start some of that conversation. It's not always a easy in the moment decision. People can change their mind from I don't want to be vaccinated to I want to be vaccinated. Sometimes that's a process. Everybody's on their own journey, and that journey's length varies per person. But that being said, what I would say to that too is also get some help. Make sure that you're not the only person who has to carry that message. Like you said, you don't want to break up a marriage. So let's, get his mom involved.
Yes.
Things that we can do if that's possible, right? So
thank you.
Yeah.
Well, I want to thank all of you so very much. I think our time is coming to a close, and I hope I've answered all of the questions that might have been there. And we certainly hope that our discussion tonight has really highlighted the critical role that vaccines play in safeguarding the public's health, our health, and certainly will lead to a reduction in the disparities that we see in our care, particularly for our vulnerable population. We understand the role that infectious diseases play, and it should be about prevention. And we hope that we can get back to that in the future. Thank you. Thank you to my panelists. Thank you to the Cobb Institute for putting this on, and for blackdoctors.org for having us on the internet, and that I think this video will be available for viewing in the future. Thank you all and have a good evening.
Thank you.